Good morning, Zoom folks.
You know anything about the stuff in Blackboard? I don't have the app. And it's saying I have to get it and I don't know if I can use my Blackboard, but I already downloaded the app and all that.
I know. The only way I know how to fix that is like, when you go to log in. There's like a little thing at the bottom that says like, click here to be able to sign in other ways. And I did that, and so now that's why I get texts, so I can sign in.
It says I want to set up a different method.
Yeah, so if you do that, then it'll let you get a text with a code to put in.
Okay.
I could never get the app to work, so that's just what I do. And it's like a little annoying, but I always have my phone on me, right? So it's not like, no problem. Yeah, that's my hack. I've been teaching colleagues and everybody is like, just ignore the app and do it this way. We'll have to see. I mean, people could come right at the last minute, but we might have a very low attendance today. That's not what I want. That's what I want. Whew. Ugh. Yeah. There will be. I'll have to write it. Thank you for the reminder. So I'll do that and chapter 50 and the next chapter too. I'll do both. Yeah, I have them all written for Psych 101, so I think in my mind, I keep thinking like, oh yeah, they're there, but this is the first time I've done them for 102, and so they're not there. So thank you for the reminder. Okay, got it on my hand, which means I won't forget it. Alrighty. So, yes, I will. My class after this is taking an exam, so I will have time, so I will write and post the next explain it to the media quizzes. Thank you to Nora for reminding me I haven't done that. And then in terms of things coming up, your infographic is going to be due a little under a month. So Monday till 5. So maybe Friday we'll take some time to go over that a little more. The other thing is just make sure you're keeping up with your Connect stuff. Your next exam is going to be distributed. Sorry. The same day your infographics due, but then you'll have a whole week to do it. Because then our exam time is when you come in and do your brief presentation about your infographic. So there is no in-class cumulative final exam. Instead, we are doing the presentations. So this is my first time doing them with an intro class, and I think it's going to be a lot more fun than an exam. We call it a hunch. So I'm looking forward to seeing everything y'all are working on. I'm just gonna check in any people who came in just now. All right. So today our agenda is we are going to finish our disorders. Then we have a Kahoot about the personality disorders in particular that we'll do. And then we'll start talking about therapies. So it'll all kind of blend together. We left off last time talking about the personality disorders, and we had gotten through the cluster A, those sort of odd schizophrenia-like disorders. And so now we are to cluster B, or the dramatic personality disorders. So these include antisocial, borderline, histrionic, and narcissistic personality disorder. And the behaviors of these people who have these disorders are so dramatic, emotional, or erratic that it's almost impossible for them to have truly satisfying and giving relationships. It really puts a strain on their relationship with other people. These personality disorders, the cluster B, are seen more often. I think partially because some of the symptoms of these mean that they would seek therapy more readily than, say, like someone with a cluster A who was paranoid and didn't trust authority figures, right? And only antisocial and borderline personality disorders have received much study, unfortunately. The causes of these disorders are still not widely understood. So we'll start with antisocial personality disorder. So if you've ever heard in the media someone described as a psychopath or a sociopath, and people try to make distinctions between those, diagnostically, they're the same. So diagnostically, someone who say, oh, that person's a psychopath, that serial killer was a sociopath, they'd all be diagnosed with antisocial personality disorder. So they persistently disregard and violate others' rights. Obviously, that's really clear in the case of like a serial killer, right? But in other less clear ways as well. So aside from substance-related disorders, antisocial personality disorder is the disorder most linked to adult criminal behavior. You have to be, as we've mentioned before, at least 18 years of age to receive this diagnosis. But most people who eventually get this diagnosis displayed some patterns of misbehavior before they were 15. And in fact, there are disorders of childhood that you can diagnose that kind of lead up to this. In particular, there's a disorder called conduct disorder that like doesn't always mean you're going to go on and develop antisocial PD, but it certainly means without intervention, you're on that path. In terms of the symptoms, they disregard and violate other people's rights, whether that is through physically harming them, emotionally harming them. taking advantage of them monetarily, things along those lines. They're very intelligent, but they can be lacking in judgment. They're sharp, they're quick, they're with it, but they have this like mask of sanity. A lot of times they don't experience and therefore they don't understand the full range of emotions or like care for other people. So they just sort of manipulate that. They have the ability to erect a good front. They tend to be charming and likable, spontaneous, humorous, upbeat, optimistic. I don't know if anyone's ever watched the show Dexter. Dexter is an example of someone with antisocial personality disorder and the way he works at a police station, which I love. If you don't know the purpose of the plot, he's a serial killer, but he only kills bad guys, basically. And he works as a blood splatter analysis at a police station. And the way he gets in with everybody else is he brings donuts, and he knows it's stereotypical, but that's how everyone's like, oh, you're the guy with the donuts, right? So they pick up on shallow stuff like that. They have an inadequate conscience. So sometimes they've been described as like morally deficient. They are emotionally unaffected by punishments. So sending them to jail or long-term prison and then releasing them, they won't have, they'll be like, okay, whatever, but just go do it again. And they have what we call anticipatory anxiety they lack. So anticipatory anxiety is like before you do something dangerous, you get a little anxious about it, right? If anyone in this room were to commit a crime, we'd all probably be pretty anxious about it before we did it. These people don't have that, so it's a lot easier for them to do these violations. They also have this sort of combination of intelligence and social shrewdness and lack of conscience. And so sometimes it's been described as a sincere deceitfulness. They can be impulsive and irresponsible. The world's kind of about them, so they have some narcissism. They're very sensation seeking. So, you know, they wouldn't necessarily enjoy hanging out with friends or sitting down to a movie the way, again, folks in this room probably would. Instead, they want to go out and do something like that gets their adrenaline going. Reality is for their gratification. They just think the world is there for them to manipulate, essentially. They reject authority and they're unable to profit from their experiences. They have erratic social histories. This has been described as historical stupidity. And they have the inability to maintain close personal relationships. So they're socially facile, but they're interpersonally really challenged. And again, they tend to be narcissistic, egocentric, cynical, remorseless. So it's hard to like establish a bond with people like that, right? People with this disorder are likely to lie repeatedly, be reckless, maybe even sexually promiscuous, and impulsive. They have a disregard for other people and can be cruel, sadistic, reckless, and violent. One interesting note about antisocial PD is people have this disorder. They don't really suffer from it. So this is one of the disorders, one of the few disorders of the DSM that does not have like significant distress or impairment as part of the criteria, because it's a recognition that other people are impaired and distressed enough by them, right? Other examples include like pedophilia. Person who's a pedophile does not have to be distressed by it in order to be diagnosed, right? This disorder is 4 times more common in men than in women. And it's about 50 to 80% of men in the federal prison system. And where are the rest? Well, the good ones don't get caught. They're on Wall Street. They're the ones who didn't care when the housing bubble burst, right? There are people, I don't know, I can't diagnose people I haven't interviewed, but sometimes I wonder about like Elon Musk, right? Things along those lines. Because people with this disorder are often arrested, we often study it in prison populations. And the studies indicate higher rates of alcoholism or other substance-related disorders among this group. So real life examples would be pretty much any serial killer, your Jeffrey Dahmers, folks like that. Media examples, in addition to Dexter, would be Anthony Hopkins in Silence of the Lambs and Matt Damon's character in The Talented Mr. Ripley. All right. And so one of the misconceptions, and the way we sort of like colloquially use the word antisocial is shy. And so I found this video kind of explaining that's not.
When you think of the word antisocial, you might think of the word shy. But clinically speaking, there are some major differences. Let's talk about some of the most common symptoms of antisocial personality disorder and put a few misconceptions to bed. Sociopathy is actually a version of APD, so think of it as the unofficial term for antisocial personality disorder. For starters, people with high-functioning APD can usually do typical everyday activities like work or maintain a relationship. However, some less than desirable traits like impulsiveness, cynicism, and lying may shine through on a regular basis. Some psychologists believe that APD may surface in children as early as 11 years old. While it's generally believed to be a lifelong disorder, some symptoms may decrease over time. So, could you have APD? Sure, some symptoms like a lack of empathy or arrogance may overlap, but these characteristics don't develop into a true disorder overnight. If you're really concerned you might have APD, look at the patterns in your life. People with the disorder have a hard time with interpersonal relationships since they struggle to connect with others in a genuine way. But one bad relationship doesn't automatically qualify you for antisocial personality disorder. In fact, even being concerned about having it in the first place may mean you're in the clear. What are some other clinical terms you're unclear on? Drop a comment below and be sure to stay tuned to
That last one I think is really important, right? If you're worried you have antisocial PD, you probably don't have it, right? People with antisocial PD would just be like, cool, and roll with their life.
When you think
All right, so the next thing we're going to talk about is borderline personality disorder. This is the personality disorder I had the most experience treating. This co-occurs quite a bit with eating disorders, and since that's what I specialized in, I saw this a decent amount. Also, while I was on my clinical internship here, I was specifically trained in a type of therapy for this, and so I did that fairly extensively. Anecdotally, working with these patients is part of what helped me realize that I'm good at being a clinician, but being a clinician is not good for me because I'd wake up in the middle of the night worried about these patients. So, you know, you have to learn to compartmentalize if you're going to go into an applied career, and I just wasn't good at it. So, instability of self-image and relationships. So this is like identity diffusion, identity disturbance. They have trouble being alone, but also difficulty like existing or being with other people. They search for faulty saviors. One of the best descriptions I can say about them is they'll like put you on a pedestal one day, and then the next day you're the worst person in the world. And that's true of therapists too. Like one week you're like awesome, they love you, you're fixing their life, and the next week like you're the worst person, they hate you. They have a history of intense but unstable tumultuous relationships. They also unfortunately often get exploited because they have this sort of like identity diffusion, so they'll cling on to the other people, so they can end up in these vicious cycles and relationships. They have emotional dysphoria and instability. They have this baseline often of almost like persistent depressive disorder, like a dysphoria, or they'll describe it as like an inner deadness. And that alternates with sometimes violent and prolonged emotional outbursts. I should say another disorder that this often co-occurs with is bipolar disorder. And when they're in those manic highs, that irritability is often a big part of it. They also have very extreme responses to potential abandonment. So someone's breaking up with them, things along those lines. If anyone's ever seen the old movie Fatal Attraction, in that movie, like when Glenn Close's lover says we can't do this anymore, she like slits her own wrists, like, or she boils a bunny. It's like really disturbing, but that can be what can happen. And they will engage in this. Oh, looks like we might have a question here. Yeah, Abby, thank you for sharing that. It was really hard to live with. I mean, these were some of the most challenging clients to work with because of how profoundly it affects your life, right? it's really hard to navigate the world when nothing is clear and it's not even clear who you are. They are impulsive, unpredictable, and sometimes engage in purposely self-destructive behavior or unintentionally self-destructive behavior. So people with this disorder are prone to bouts of anger, which can result in physical aggression and violence towards others. But I would say more often, they direct their impulsive anger inwards and self-harm. That really is sort of a hallmark of this disorder, is the self-harm behaviors. So whether that is parasuicidal behaviors like cutting themselves, burning themselves. One client I'm remembering distinctly from my internship year had tried to overdose on her medication 3 times the month before she saw me. And other things they can do is abuse alcohol or other substances. That same client I just described had COPD, which is a lung disease, and she was on oxygen, and she would smoke cigarettes while she had her oxygen on. Like, I don't know how much people are familiar with like basic chemistry and physics, but that can literally result in an explosion, right? So very dangerous. Reckless behavior, driving while intoxicated, unsafe sex, suicidal actions, suicidal threats. And as I mentioned, there's also this high comorbidity with the eating disorders, particularly bulimia nervosa. So for some folks with borderline PD, it will become like the binging and purging also becomes like a self-harm or a self-punishing behavior. Close to 75% of those diagnosed are women. And the course of this disorder varies. In the most common pattern, the instability and risk of death by suicide reach a peak during young adulthood and then gradually lessen with age. That being said, when I was working with our group for these folks, I would say we had all women in their 40s. So, you know, it doesn't necessarily always follow that path. So why is it called borderline personality disorder? So the original idea was that it was on the borderline of neurosis and psychosis. Neurosis, an old word meaning anxiety, psychosis like schizophrenia, because it does share some symptoms of anxiety, some symptoms of psychosis. One of the things I didn't mention as a symptom is they will often dissociate, particularly if they have traumatic histories, which is not uncommon. Unfortunately, like DID, these folks often have a history of physical, sexual, emotional abuse. And so sometimes when you're in therapy and talking about difficult things, you kind of have to like bring them back because they zone out. And it's not just like when you and I like daydream, right? It's like they dissociate, they kind of go to a different place to protect themselves. They tend to have disturbed relationships and disturbances in their experiences of themselves. So this character doesn't have borderline PD, but I always thought that this example that I'm going to give you is one of the examples of like loss of not having a good sense of self. So the movie Runaway Bride, Julia Roberts always says like the type of eggs she likes is what whoever the guy she's with, the type of eggs he likes, right? That is so again, her character doesn't have this disorder, but that is something you might see in someone with this disorder. And then they can have transient psychotic symptoms as well. So about 50% of those with this disorder also suffer from depression or bipolar disorder. They also have very similar symptoms to a lot of the other personality disorders. So they can have the same oddities of thinking and ideas of reference and depersonalization as someone who's schizotypal. They also have some similar symptoms to the next 2 disorders we're going to talk about, histrionic and narcissistic. And then they can have some similarities to antisocial PD, where they have conduct problems, unstable history of employment, and unstable relationships. So some case examples I already told you: Glenn Close and Fatal Attraction, Winona Ryder's character in Girl Interrupted. And then I could give you an example. I had a client who had bulimia nervosa, was abusing cocaine, and also had borderline PD. And when I introduced the empirically supported therapy for bulimia to her, she's just started screaming at me. Like, one of the things you do in treatment for bulimia is you have people monitor their food intake and like when they binge, when they purge, what's going on. And she just started screaming at me, monitor? You want me to monitor my food? Like, and I got her calm down, but it was like to the point that after she left, other people in the clinic were like, are you okay? Is your client okay? And we had like noise canceling machines and whatnot. So yeah, it can be very, very overwhelming to work with these folks. So this is a quick video about people who live with borderline PD. And he is also going to talk about, again, giving sort of a trigger warning here. He's also going to talk about suicide.
My name's John Minus, and I work in mental health. I was always kind of moody. My mother had depression, and she actually killed herself when I was 23. And after that, everything, like my own symptoms just started getting really worse until I started going on meds, I think, when I was like 27 or so, because I just had a lot of anger towards everybody and everything. And I was never an angry person, so I didn't know how to deal with it. So it would just come out randomly because I didn't know what to do with it. I never dealt with anger. I never had to deal with anger. Like, usually things just slid off me. About 2 weeks after my 30th birthday, I admitted myself to a psych hospital because I wanted to kill myself. It's made things hard. Because my brain was never wired right. And a lot of the things that make me funny and creative are the things that make it so I can't function in life. So it's...
And like, that's something I should say in general about psychopathology. There is like a history of people who are very talented artistically experiencing psychopathology in general. And a lot of times, it's like, well, there can be these good things about my symptoms, but then obviously you suffer the consequences as well. I think that gives you enough of a vibe of what, John and other folks have had to live through. So we can talk about the other two cluster B ones. Again, we don't have as much study about them. So that's why there's less information on the slide. So histrionic PD is people who have this are extremely emotional and seek to be the center of attention. So they engage in attention-getting behaviors. Approval and praise are their lifeblood. They are sometimes described as vain, self-centered, and demanding. Some will, like people with borderline PD, engage in parasuicidal behaviors to manipulate others more so than, again, like in borderline, it's more like to deal with the overwhelming emotional pain they're feeling, right? This disorder was once believed to be more common in women and men. However, research has revealed that there were past gender biases and diagnoses, where essentially this was seen as like a women's disorder, and so they wouldn't diagnose men that have it. And since they've corrected that, it actually occurs equally among the genders. Case example, musical theater majors, right? I'm sorry, so I know that's a stereotype, but just sort of that sensation, like wanting to be the center of attention. And then Scarlett O'Hara's character in Gone with the Wind. Narcissistic personality disorder. These folks are grandiose. They need admiration and they feel no empathy for other people. They're convinced of their own great success, power, or beauty. So they expect constant attention and admiration. I had one client ever I saw with this. I did his intake and I said, can I pass this client off to somebody else? Because I just couldn't. He was writing the great American novel. He didn't have anything on the page yet, but he was writing the next great American novel. People with this disorder exaggerate their achievements and talents, and so they can appear arrogant. And they're seldom interested in the feelings of other people, and so they might take advantage of other folks to achieve their own needs. Up to 75% are men. And this is one of the reasons why we don't diagnose this until you're 18, These behaviors are very common in teenagers. If any of you have younger siblings who are teens, you may be like, "Ooh, what do you think of this?" It doesn't mean they have this disorder. Another example, in addition to my client, from media is Frasier Crane from the show Frasier. All right, so cluster C are referred to as the anxious personality disorders. And so they include avoidant, dependent, and obsessive compulsive personality disorder, which is distinct from obsessive compulsive disorder. So they're typically displaying anxious and fearful behavior, and there are similarities with anxiety, but there's no like genetic link to what we used to call axis 1 disorders like anxiety and depression. Research is limited for a lot of these, but the really interesting thing is that even though they don't seem to like genetically be related to anxiety disorders, a lot of times the treatments we use for anxiety disorders will help with these. So we do have good treatments for these folks. So avoidant PD, people with this disorder are very uncomfortable and inhibited in social situations. They're overwhelmed by feelings of inadequacy and extremely sensitive to negative evaluation. They believe themselves to be inferior or unappealing. They often have very few close friends. It's similar to social anxiety, and you could experience both. Actually, you could be diagnosed with both. So similarities between this and social anxiety are the fear of humiliation and low self-confidence. But a key difference is that people with social anxiety fear social circumstances, fear being judged in public, whereas people with this, with the avoidant PD, tend to fear close relationships. So they don't want to get close to anybody. Example here, one of my fellow clinicians in our training clinic saw a client with this, and she essentially ended up using treatment for social anxiety. So very socially anxious, afraid to get close to others. And so she used things like, I was our assistant clinic director at that time, and she gave him an assignment that he had to go say hi to me and talk to me after session, just because like that was a big deal for him. Dependent PD, people with this disorder are very uncomfortable and inhibited in social situations. Overwhelmed, oh, sorry, I'm reading the avoidant one. It can be that. But the defining features here are they have a pervasive, excessive need to be taken care of. So they're clingy and obedient. They fear separation from their loved ones. They rely on others so much they can't make the smallest decisions. The central feature of the disorder is a difficulty with separation. They often feel distressed, lonely, and sad, and dislike themselves. They're at risk for depression and anxiety disorders, and may be prone to suicidal ideation or suicidal thoughts. So, case example of clients who is in their 30s and still living at home, and the relationships don't last because they're seen as very needy. Another client who was in her 40s, and her husband gave her an allowance every week, like she was a kid. And then Sophie in Sophie's Choice, she returns to her lover despite his psychological problems because she sort of can't stand to be alone. Obsessive compulsive PD, people with this disorder are so preoccupied with order, perfection, and control that they lose all flexibility, openness, and efficiency. They set really unreasonably high standards for themselves and others. And like, I can't wait till the end to give you guys examples. So this is one of my very first therapy clients had this disorder, and it really ruled her life. And so, for example, if she had just done laundry and her friends were like, let's go out and like have dinner together, she would not do it because she had to make sure her laundry was put away, organized not only by color, but also by sleeve length within color. And then she, in terms of this high standards for self or others, I think it was like our second session, she told me like, she and a friend had been in a fight. She was like, 2 strikes and you're out. And I was like, that's not how baseball works, right? I ended up just sort of on accident figuring out a way to sort of like challenge her on her homework she did for me. One day someone had put colored paper in the printer, and then she couldn't white out without me knowing it. She would like white out and make her therapy homework perfect. So let's see, they're rigid and stubborn. They fear a mistake, so they can be afraid to make decisions. They have trouble expressing their affection, and their relationships can be stiff and superficial. Men are more likely to have the disorder than women. Many clinicians believe that this disorder may be related to OCD, but there's no specific link that we've found yet. And so OCD, again, is much more about like, if I don't do my checking behaviors or whatever my compulsions are, something horrible will happen. And this is much more about like, everything just has to be perfectly done. All right, so now I have a Kahoot here about the personality disorders. So I will give you all a minute to get all logged in here. So if you have the app, you can use that, or you can go to kahoot.it and put in this game pin. And folks on Zoom, please feel free to join in as well. All right, I'm gonna give it just another minute in case anyone else wants to join in. Yeah, I've got a couple of people still popping on, and then we'll go ahead and get started. And after we start, you can still join too. All righty. So just like the one we did on Monday, each of the questions will be a description of a disorder, and then you're gonna diagnose the person. So LaShonda danced into the party and immediately became the center of attention. She boasted about her career as an actress in a local theater company. She denied any problems in her marriage, and then she fainted and had to be taken home after this conversation. Jalen, you should still be able to join even after we started. So go ahead, and the pin is at the bottom. So it's 3696465. I'll go ahead and copy paste it for folks into the chat. Yeah, so this is histrionic, what we just talked about, right? This is one where they're going to be dramatic, and that's sort of how they cope with life. And so I forgot to give the premise. Each of these people are people who come to a party, and this is how they act at the party. All right, so Wilhelm wandered into the party, but didn't stay long. He spoke with a few other guests. The guests found him aloof and something of a space cadet. He found the room to be filled with negative forces, which he thought were going to influence him in some way. Alrighty, so yeah, this one is schizotypal. Honestly, schizoid, paranoid, schizotypal are hard to parse out, which is one of the reasons why I do this activity, to sort of help you sort that. And you'll see in a minute sort of what the future psychology is trying to do about that when we go back to our PowerPoint. Alrighty. So Winston spent most of his time talking about his trip to Europe, his new Mercedes, and his favorite French restaurants. People seemed bored around him, but he kept right on talking, made a critical remark about how one of the women's are dressed, but did not apologize for his obvious blunder. He tried to talk his way around it and blamed her for being upset. Upset, not obsessed. Yes, narcissistic, most of you got it. So someone who's just sort of really full of themselves. And again, not every person who's narcissistic would be pathologically narcissistic, like diagnosable, right? Is where it really interferes with their lives. All right, so now we have Maria. Maria was inebriated, laughing and giggling. She flirted. Twice during the evening, she disappeared with different men after a violent argument with one of them. She locked herself in the bathroom and attempted to swallow a bottle of aspirin. Her friends encouraged her to go home, but she was afraid to be alone. Yeah, and that one, the description's too long. So a lot of you didn't get to answer. But yeah, it's borderline PD, right? This very volatile behavior. All right, board is switching up a little bit here. All right, so Jamal was exactly on time. He spoke to each guest for 5 minutes. He talked about technology and finance and avoided any questions about his feelings or personal life. He left precisely at 10 p.m. because he had work to do at home. Yep, exactly. So this is obsessive compulsive. This is that needing things, everything to be just so, and your social life is interfered with by like things you feel like you have to do other than that. All right, Onyx has a streak. Awesome. All right, how about Donna? She waited outside. She seemed really uncomfortable when people tried to be nice. She looked guarded and distrustful. People became uncomfortable with her habit of finding faults in every little thing you said or did. She seemed to be picking fights with people, and she didn't stay very long at the party. Yeah, and again, this one is hard. The 3 cluster A ones are really hard to parse apart, to be perfectly honest. So, but yes, this one was paranoid. Oh, switching up the leaderboard a little bit here. All right, so David wasn't invited. No one knows him well because he rarely talks. He's most comfortable when he keeps to himself. He spends his time at home reading. That's where he was during the party. Yeah, so again, cluster A, who knows, but this one is schizoid. This is the, again, like the taxi driver, you know, are you talking to me in the mirror by yourself? All right, didn't switch up that time. So Tiffany arrives with a friend. She would not leave the side of her friend, even to go get refreshments or go to the bathroom. Tiffany's friend wanted to talk to a guy she liked, but Tiffany became extremely upset by this because she didn't know what to do or how to act without her friend by her side. Yep, so this one's dependent. This is that clinginess. You can always just think of that graphic I used on the slide of the koala around somebody's leg, right? All right, a little bit of switch up, a little bit of switch up. Couple more here. So Taj was quite intimidated by the party. He saw an attractive woman, but he was extremely nervous about talking to her. He feels rather inadequate and is fearful that the woman would reject and criticize him. He left the party early without talking to many people. Yep, most of you got it. This one's avoidant, that sort of social anxiety feeling one. Some switch ups, some switch ups. All right, last one. So Max talked to many people at the party, trying to get them to buy into his new business venture, which was a cover for his smuggling ring. After Max's brother Mark complained Max was talking too loud, he got aggressive with him, punching Mark in the gut. He showed no regret for what he'd done, claiming that Mark deserved it. Yeah, so this one is antisocial. I could see borderline, but the like smuggling ring thing kind of is what tips it off. Again, sort of think about, I hate to use this as an example because I know it's controversial, but like the guys who are really into crypto and like want you to get into their specific crypto because they got a great deal, right? Some of that you got to watch out for. Alrighty, so we got a podium. So Lauren is a number 3. And Onyx is number 2. And Sarah is number 1. Yay! So again, just sort of a fun activity to help you all start to think about these disorders in a different way. All right, we just have, I believe, one more slide on this one. Couple slides, but just sort of talking about the same thing. So in the appendix of the DSM-5 that came out in 2013, there is an alternate proposal for diagnoses for personality disorders. And as you can see, again, how we were all struggling with like, which cluster A is it? They basically collapsed down the cluster A disorders to all just be schizotypal because they're so similar. But they would keep antisocial, keep avoidant, borderline, and obsessive compulsive PD. And then they also talk specifically about traits. So personality trait domains, so negative emotionality, anxiety, depression, guilt, shame, worry, and they would be really emotionally volatile, anxious, have that separation insecurity, low self-esteem. Introversion, pretty straightforward, social withdrawal, social detachment, but can also be related to almost like depressive symptoms like restricted affect. Antagonism, see this in some of the cluster Bs, a little bit of schizotypal as well. Callousness, manipulativeness, narcissism, hostility, aggression, oppositionality, deceitfulness. Disinhibition, impulsivity, distractibility, recklessness, irresponsibility. Compulsivity, the tendency to think and act according to a narrowly defined and unchanging ideal. This includes perfectionism, rigidity, orderliness, risk aversion, so most dominant in obsessive compulsive PD. And then schizotypy, a range of odd or unusual behaviors and cognitions. And so these would be unusual beliefs or perceptions, dissociation proneness. So I went to, in fall 2012, I went to a conference and saw the psychologists who came up with this new definition set. And I've never been to a panel where people were more like defeated. Like normally in panels, people are pretty excited to talk about what's going on. They had presented this to the Little APA, the American Psychiatric Association, who writes the DSM, again in like September, October 2012. And the Little APA said, no, it's too late to get that in the DSM, but we can add it as an appendix. So like, wait, it's too late to get it in, but we're adding it. So technically the DSM-5 has 2 different sets of diagnoses for personality criteria. Yeah, the psychology and science in general are not always smooth. We'll put it that way. All right, now we're going to start a little bit of our psychotherapy lecture, but we have plenty of other days to talk about this as well. All righty. Therapy is obviously something I was trained in. So it's really exciting to talk about it with y'all. And I know that therapy is often something folks envision themselves going into when they're taking an intro psych class or when they're becoming a psych major. So probably really relevant for a lot of folks in this room, I would imagine. So the definition of psychotherapy is that there's an interpersonal relationship between at least 2 participants. And again, typically it's going to be just a therapist and a client, but you can also have couples therapy, family therapy, group therapy. The therapist is someone who has special training and expertise in handling psychological problems. And then the client is experiencing some sort of difficulty psychologically, and has entered into this professional relationship with the therapist in order to alleviate that problem. So the idea is that the client comes to this trained professional seeking help. And now, full disclosure, the client does not always come willingly. I certainly treated some adolescents who were sort of dragged by their folks, and you could tell, right? And then there are times when, let's say, someone might be court mandated to do therapy because of a substance use issue or something along those lines. So that can be a lot of your job as a therapist is to try to establish that working relationship, what we call rapport between you and the client, and get them on board. Often these problems are emotional in nature, so something like anxiety, depression, behavioral. So it could be someone who, again, is abusing substances, has gotten in trouble with the law, is engaging in parasuicidal behaviors, or interpersonal. And I mean, this is really an and/or, because there are definitely people who come with all three. And, they're having trouble in their relationships, they're having trouble at work. So this is another way where people could be mandated to therapy, is if you're having like anger issues at work, right? They might require you to go through some sort of training or therapy. But the vast majority of the time, people come to therapy because they want help, and the therapist is there to help them. So this is a study, gosh, it's nearing on 20 years old now, by Olson and Pincus. And this, they talked about and looked at the use of non-hospital outpatient mental health services. And that's a really fancy word for just going to see a therapist, like we assume people go to see a therapist, right? So you're going to an office, you're going usually once a week. After you're done with therapy, you leave and go home and go about your life. Okay, so that's what outpatient therapy is. And so people are more likely to enter therapy if they have insurance than if they're not. Probably not surprising, because therapy can be very expensive if you don't have insurance. People who are divorced or separated are more likely to go into therapy. People with more education are more likely to seek out therapy, likely because even if their education isn't in the realm of psychology, they recognize the potential benefits of it, right? So over 16 years would be having finished college, basically. With respect to age, we see that utilization peaks in this 35 to 49 age group. And this is the point in your life where you're mature enough to realize when you need help, and that seeking help is not a sign of weakness, right? I think sometimes, especially for young people, it's hard to wrap your head around that going to therapy is not hard. Although I feel like that's different with y'all's generation, and I really like that, makes my heart happy that people are much more willing to seek help, which is really, really good. And women are more likely to enter therapy than men, largely because of our society's ideas about masculinity and toughness and things along those lines. So who provides therapies? So it could be someone like me. It could be someone with a PhD or a PsyD in psychology. They would deal with more severe cases. These folks sometimes would be in private practice, but often are working in hospital settings or university medical schools, at the VA, places like that. Psychiatrists, which we talked about at the beginning of the semester, these are the folks who get an MD and then additional training, and they are going to help with psychotropic medications. Some of them also do therapy. And then there's a whole host of other people, social workers, psychiatric nurses, counselors. Usually these folks obtain a master's, and then there's licensure you can get at the master's level. So like a licensed clinical social worker, LCSW, or you'll see people who are like LCP, I'm forgetting the things, but basically at the master's level with a counseling degree, you can get licensed as well. And these are the vast majority of people who are like on the ground doing that day-to-day outpatient therapy. All right, we'll wrap up there for today and pick up with talking about medications on Friday.